A carousel of digitally drawn images about long COVID. The first image has a pastel background with stripes of bright colours in the top right and bottom left corners. There is a white person with a thoughtful expression in the bottom right corner. Text in the centre reads, YDAS_VIC. Long COVID. What exactly is long COVID? Hashtag boosting information. The second image has a pastel background with stripes of bright colours in the top left and bottom right corners. There is a digitally drawn set of lungs in the top right corner. The text in the centre reads, Long COVID is sometimes called post-COVID-19 condition or chronic COVID. The third image has a pastel background with stripes of bright colours in the top right and bottom left corners. A digital drawing of a person of colour is partially visible in the bottom left corner. Text in the centre reads, Long COVID is when you still have COVID symptoms 12 weeks or 3 months after getting COVID. The fourth image has a pastel background with bright stripes in the bottom left corner. The bottom of the stripes is obscured by 3 people of colour. The middle person is wearing a headscarf and the person on the right has their eyes closed and is leaning their head against the middle person. Text in the centre reads, 1 in 3 people will experience at least one post-COVID symptom. If you're unsure about this, you can speak to your doctor. The fifth image has a pastel background with bright stripes descending from the top right corner. There is a digital drawing of an ill-looking person with long hair in a side ponytail in the bottom right corner. Text on the right reads, Your doctor might ask whether you have experienced some common symptoms such as changes to your sense of taste or smell, a cough, joint or muscle pain, tiredness, mood changes, and anxiety. The sixth image has a pastel background with stripes in the left corners. Text in the centre reads, Some less common symptoms include trouble sleeping, mild fever, headache, and confusion. The seventh image has a pastel background. Text reads, If you are experiencing any of these symptoms, you should speak to your doctor as soon as possible. Breathlessness, fainting, severe chest pain, unexplained changes to sensation, vision, or coordination. GP respiratory clinics can also be accessed for free in person or over the phone. There is a QR code at the bottom of the image that is linked to the Victorian Government webpage with information about respiratory clinics. The eighth image has a pastel background with bright stripes running through the middle. Top left text reads, If you're fatigued, feeling anxious or disoriented, you're not alone. Many have lost jobs and many LGBTQIA+ young people may have lost their safe spaces after having to isolate with homophobic or transphobic family members. Quote from Paige, 18-year-old dyspraxic with lived experience of anxiety and processing disorders. The ninth image has a pastel background. Bottom right, person with facial hair smiling at a doctor who is wearing a stethoscope around their neck. Text in the centre reads, You should talk to your GP regularly if you are experiencing any post-COVID symptoms. They can also refer you to other services, such as psychologists, physiotherapists, or occupational therapists.